consultant endocrinologist with Magnacentres for Obesity, Diabetes and Endocrinology, Bangalore. Today I'm going to talk a bit about gestational diabetes. So what is gestational diabetes? Gestational diabetes refers to diabetes that occurs during pregnancy. So typically a pregnant woman at the time of booking or in the first antenatal visit, blood glucose is always checked, and at that time the glucose is found to be normal. And then later on during the course of the pregnancy, say between 24 and 28 weeks, this individual develops an abnormal glucose level, and this is referred to as gestational diabetes. Okay, typically the blood glucose level following a glucose challenge should be less than 180 at 1 hour and 153 at 2 hours when you give a 75 grams of glucose, and the fasting value has to be below 95. Okay, so if blood glucose levels are above this level, so then it is considered gestational diabetes. And why does gestational diabetes occur? Gestational diabetes occurs for the same reasons that type 2 diabetes occurs. It's a combination of many factors. One is the genetics of the individual, which is predominantly responsible for the onset of gestational diabetes. The second one is the age of the patient. The older the patient, the higher the risk of getting gestational diabetes. Because you cannot modify either the age or the genetics of the patient, we can only be careful in trying to diagnose who is getting gestational diabetes. The third and the fourth most important factors for the occurrence of gestational diabetes include diet and physical activity. So if an individual consumes a lot of excess calories, puts on a lot of weight during pregnancy, that constitutes a risk factor for getting gestational diabetes, just like type 2 diabetes. Consuming foods like cola or aerated beverages, fruit juices, a lot of biscuits, so high calorie value and high carbohydrate content in your snacks will predispose you to get gestational diabetes while you're pregnant. So there is a lot of misconception regarding diet during pregnancy, and many women are told to eat more and excess quantity of sweets, etc. during pregnancy, and pregnancy is a time when you should eat more. So this is culturally a very common misconception, and this can actually give rise to a high risk of gestational diabetes. And so is lack of physical activity. So lack of physical activity is very common in our country nowadays, because many women are actually working from home or working from office, and the amount of time spent doing physical activity is very less. So with pregnancy, what happens is that a lot of people reduce their accustomed physical activity. For instance, they are doing yoga or going for a walk daily. Usually after pregnancy, due to the fear of miscarriage or preterm labor, they are asked to stop the physical activity. So when the doctor asks them to stop the physical activity, they completely stop it, and this itself constitutes a risk factor for gestational diabetes. If we take care of these aspects, that is namely good diet and exercise,